Untangling Pandas and Pans is a podcast about two little-known medical disorders characterized by the sudden and dramatic onset of symptoms such as obsessions and compulsions, vocal or motor tics, and restricted eating behaviors, and a whole host of other symptoms following a strep or other bacterial or viral infection. I have the privilege of interviewing some of the top researchers and clinicians in this rapidly growing area, known by various names such as immune-mediated neuropsychiatric disorders, infection-associated neuroimmune disorders, and autoimmune encephalitis, or simply PANDAS and PANS. My name is Dr. Susan Manfull. I am a social psychologist, the executive director of the Alex Manfull Fund, and the mother of Alex Manfull, who died at 26 years old due to PANDAS, a disorder my husband and I knew next to nothing about, certainly not that our daughter could die from it.
This is Episode 3, Part 2 of Untangling Pandas and Pans, recorded May 13th, 2024.
Welcome back to my conversation with Dr. Shannon Delaney. In Part 2, we will talk about diagnosis and treatment. What is the issue with these tests? Why are they sometimes negative?
Well, there's a lot of factors involved. One of the biggest factors is that decades ago, when they wanted to, well, first of all, let's back up for a second and say, even the CDC acknowledges that Lyme disease is a clinical diagnosis, actually. So like PANDAS, which is a clinical diagnosis, so is Lyme disease. Most people don't realize that and or acknowledge the fact that Lyme disease is a clinical diagnosis. So for example, remember the patient I was telling you about, the 38-year-old who was totally healthy and now comes in with fatigue and joint pain and cognitive problems and new onset panic attacks and depression. That's Lyme disease clinically. Like they live in a tick endemic area. They're presenting with classic symptoms. I would be comfortable diagnosing them with Lyme disease. The problem is, I think a lot of doctors don't realize that it's a clinical diagnosis. So that instead, they will do a simple ELISA test, let's say from LabCorp or Quest, and it will come back negative. And those particular tests, if you don't order the right things, if you just do an ELISA test that only reflexes to a Western blot test, for example, if it's positive, I've seen so many patients through the years that will go to their primary care doctor. They will only do what's called an ELISA test. It's negative. They never even get a full kind of Western blot test done. And they're told this isn't Lyme disease. Well, that's incorrect medicine. You have this patient who had no symptoms, presents with classic symptoms of Lyme disease in a Lyme disease endemic area. That's Lyme disease. So that's number one problem. Number two problem is that decades ago, they developed the parameters for testing. This is back in, so Lyme disease, the bacteria was first discovered in the early 80s. And really within that decade, a bunch of scientists got together and they wanted to determine how do we decide if someone has had Lyme disease or not from a public health perspective, so we can keep track of how many people are getting Lyme disease. Well, all the scientists got together and they decided that they wanted to have a very rigid criteria if it was a surveillance, if it was a public health surveillance criteria. So their criteria was they were aiming for 100% specificity. Well, that can be good sometimes for tests. If you're doing a research study or you're doing X, Y, or Z and you want 100% specificity. If you're going for that high of a mark for specificity, you're going to suffer in terms of sensitivity. So the test was built as what we would normally think of as rigid research standards, but it's been applied clinically to all these people who have Lyme disease. So in terms of the Western blot, most people have heard of that test. So there's something called an IgM Western blot and an IgG Western blot. So just to kind of put things very simply and not go into the woods too much. IgM antibodies are usually early antibodies, not just for Lyme disease, but for any infection. They're developed in the first few weeks to max like 4 to 6 weeks of the infection. After that time point, the body's immune system kind of knows what it's dealing with in terms of the pathogen a little bit more. And so it makes more sophisticated antibodies, the IgG antibodies. So that's when the more long-term IgG antibodies come to play. So when they were coming up with these tests, they were looking at IgG Western blot. So if you've heard of people saying like 5 bands positive on the Western blot, the bands represent antibodies, certain antibodies that each have numbers that correspond to certain parts of the Borrelia burgdorferi protein. And so the scientists got together and they said, okay, we think that there are 10 like specific parts of this protein. So in order to get 100% positivity, like specificity, that someone has had Lyme disease, we need to see that they're positive for 5 out of these 10, and that's 100% specificity. So they need to be positive for 5 of those 10 bands. So that's great when that happens. And it sometimes does happen. I recently had a friend who lives in my community who I play tennis with, and she all of a sudden one day presented, we were playing tennis, in her arm, she developed an giant elbow bursitis out of the blue, like no context whatsoever. She didn't injure it, nothing happened. But where we live, there's a lot of tick-borne illness, there's a lot of Lyme disease. She's lived in the area for 30 years. And I said, okay, well, I think you need a Lyme disease test. I think you should send it to this particular lab because I trust this lab and their testing. Well, it turns out she was positive. She was positive for those 5, all 5 bands, 100% specificity. Of course, we don't know for sure that the Lyme disease is causing her elbow bursitis because they didn't take any fluid out to try to find the bacteria, but there's a pretty good, like, positive correlation likely. But I bring that up because that's not always the case. It would be great if everybody who has Lyme disease, we just do a test and they come back positive for 5 bands and there's no controversy and we can just say, oh, great, now they deserve treatment. Usually it's a little bit more complicated. So even sometimes patients will present with 4 bands, for example, which is like pretty significant. And you can have doctors who don't know anything about Lyme disease and they're like, okay, no, this isn't Lyme disease. Like the CDC says that you need 5 bands positive. They're only positive for 4, so this isn't Lyme disease. Meanwhile, they have all the classic clinical symptoms that we just talked about, kind of thing, right? So that's just bad medicine. Doctors aren't educated enough in the topic, for example. And the other unfortunate piece is that there's a lot of variability from lab to lab. You would think that the same person's blood taken from this at the same moment sent to a few different labs, you should get the same result, right? We had a consultation clinic at Columbia, so we would send to a few different labs because when it's positive, you can trust it, like I said, because the specificity is so high. But what that means is that if it's negative, you can't fully trust it because the sensitivity is low. That's why we would send it to a few different labs because we would know that we see different responses. And so it's not uncommon that I could see someone totally 100% positive from one lab. And occasionally they would also be like positive for 0 bands at another lab, which is so incredibly frustrating. Yeah, all of those things probably sent to a couple different labs. Make sure that they do, I mentioned before, the ELISA test, that sometimes ELISA is different from the Western blot. Remember how I talked to you about the bands of the Western blot? Those are like fingerprints because it's each individual antibody. The ELISA test is different. It quantifies the total amount of antibody. It just gives you a number. So some of the tests, if you just do the ELISA, if it's positive, it will then do a Western blot, but if it's negative, it will never do that Western blot. So for example, knowing that both an ELISA and a Western blot should be tested, and then probably tested at another lab, for example. I like Medical Diagnostics Lab in New Jersey. They accept insurance. It's a tick-borne illness specialty lab. A lot of the specialty labs don't accept insurance, but they do. They have really good Lyme disease testing. So I usually do it from 2 different labs just so because you have a clearer picture of what's going on. So yes, patients should advocate. I find that most patients have good intuition about what's going on with their brain and their body. And usually if they think they have Lyme disease, they probably do.
Mm.
Just because oftentimes they've been like dismissed by medical professionals and it's been like many months or years and they're just getting sicker. And remember, there's a lot of other things you can get in a tick, not just Lyme disease. So if the Lyme disease testing is negative and you actually do like appropriate and thorough testing, it could be something else, because oftentimes these tick-borne illnesses, there's a lot of overlap in their symptoms.
Okay, something else like one of the other Babesia, for example.
Yeah, like it could be Babesia. It could be Borrelia miyamotoi, because that's another Borrelia that presents with a lot of similar symptoms.
I see.
I've had patients. I had like a patient, for example. So some of the other ones like Anaplasma ehrlichia, they're a lot less common in the ticks. So if you look, like if you survey the ticks in New York and you look to see what's in them, by far most of them have Borrelia burgdorferi in them. Like over 60% or something crazy high like that have Borrelia burgdorferi. Less than 10% will have some of these other like more obscure tick-borne illnesses. But I look for everything, so I find it. So like, for example, not too long ago, I saw a 17-year-old girl who is struggling with like ADHD and some other kind of symptoms now, but she had like a PANS presentation when she was 5. She had a high fever. She had psychosis that lasted for many, many months. And then she eventually, I think, was treated with a month of antibiotics, and the psychosis eventually got better, but she's had mild neuropsych symptoms kind of since then. Well, I did the full workup on her, and I believe she ended up being antibody positive for anaplasma and I think also Bartonella. Did the anaplasma and the Bartonella, did she have that? Was that her presenting infections when she was 5 years old? I have no idea. We can't prove that. But it's possible. I mean, she still was mounting an antibody titer and she had never been treated for that. She had been treated, I think, with amoxicillin, which wouldn't really have covered anaplasma so much. Doxycycline covers that. So these presentations can be often very complicated because there's no way to prove, that was happening at the time. But it's suspicious that she had that story when all the symptoms started. It's a rare infection. No one looked for it. And then how much is it contributing to her current presentation? I don't know. So these are all examples of how like not straightforward a lot of these cases are, but you just have to basically go forward, like being comfortable with the uncertainty, which is not always easy as the physician. It's not the easiest. And I mean, oftentimes there's so much uncertainty that I don't ever have a follow-up conversation with kids, for example, unless they're like 17 years old and they're not anxious and they can hear, like they're fine hearing about things. But usually I would talk to the parents and then they would translate to the kid, because it's hard enough for adults to just sit with all of this information. Because it is anxiety provoking. And if you're hearing that this might have been going on in you for years and it wasn't treated, and I can imagine it might not go well.
No, that in itself would be anxiety provoking. So it's dormant until another infection pops up or until something happens to the immune system.
So we don't understand why and when and how this actually works. I've had numerous cases. So for example, the friend that I play tennis with, a couple of months prior to that, we play tennis a lot. So like she talks about her medical history. A few months prior to the elbow bursitis, she was telling me that she was using a nasal steroid inhaler, like way more than she normally did, for like a month straight. And she was using it a lot. And then she tells me that she developed all this weird like hip pain that was kind of migrating to different places. So at that point, I was already like, okay, I wonder if the steroid that you were using like weakened your immune response enough for the Borrelia. So I had Lyme disease at the back of my head when I was hearing about her like hip pains, because I remember she was telling me about the steroid use. Because I have seen with quite a few patients that, for example, they have some pain in their ankle or something, they're given high dose steroids, and then all of a sudden, like the infection goes wild and rampant. And it's goes from being like a minor symptom to like all of a sudden they have severe symptoms everywhere. So of course that doesn't always happen, but I've heard enough of the horror stories to be worried about steroid use. So that's also going back to like, do I use steroids? I don't. And that's mainly because I hear about all the bad stories. I'm sure there's plenty of people in the PANS world who have some of these infections and get better because the neural inflammation is improved with steroids.
Mhm.
I don't go there because I hear all the bad stories.
Whoa. Okay, so let's say you identified that it's Lyme. Um, can you just run through briefly what you would do to treat it?
Sure. I mean, what's the context? Is this a kid with PANS Lyme? Is this an adult?
Since we've been talking, let's take the kid to begin with.
Yeah, so it sort of depends, but I use a lot of Ceftonir for like a PANS presentation, even if we don't exactly know the trigger actually, because Ceftonir has good coverage for strep, it has good coverage for Lyme disease. It's a generally like much better tolerated antibiotic overall. The doxycycline, which is usually considered a first-line treatment for Lyme disease and some of these other things you can get in a tick, like Anaplasma, Ehrlichia, that kind of thing. Doxy is first-line treatment for that, but doxy can be very harsh on the gut. A lot of people don't do well on doxy. If you have a sensitive stomach, some people will vomit. They'll be nauseous the entire time. There's a ton of sun sensitivity with doxy. So I do use doxycycline, and some people do completely fine on it and do great on it. But in a typical PANS-PANDAS situation, kind of one of my go-tos is Ceftonir, just because it's well tolerated and kids do well on it. And I think that they do well whether it's strep or Lyme disease.
Do you recommend cognitive therapy with your clients?
It depends. Like in the acute PANS phase of things, CBT is not helpful because the symptoms are so intense that they're not able to sit and do CBT. You have to have insight. You have to have like a calmer central nervous system to participate in therapy. But once they start getting better, it can be super helpful, especially for the OCD symptoms and especially for little kids. I mean, it can be helpful for any age, but when kids can understand and put a name to the PANS or the OCD, a lot of kids name it. And so they're able to like better like cope with it, and they can say that it's coming back, and there's like a language to talk about it. So yeah, once they're getting better, CBT can really be helpful.
Okay. And then in doing my research, I came across a couple of articles that suggested that essential oils from garlic or other herbs were effective in treating Lyme disease. Any comments on that?
Yeah, so a few years ago, there were really the first studies, I think maybe 2018 and 2019 were some of the first studies that came out looking at herbs and essential oils. And what they did, these were in vitro studies, so that's important to know. These are not with human patients. But in the lab, they compared various herbs and various essential oils against various antibiotics in killing the Borrelia bacteria. They also looked at other things like Babesia and Bartonella in some of the studies. And amazingly, in the herbal study, a lot of herbs actually outperform the antibiotics in the lab. So the herbs that did the best were Cryptolepis, completely eradicated the Borrelia bacteria, Japanese knotweed, and also Chinese skullcap.
Mhm.
Those were the three best performers. And then the essential oils that did the best were oregano oil, cinnamon bark, and clove bud. And so there is actually a pharmacy that has compounded those 3 essential oils based on that paper, that publication. So I often refer patients to that pharmacy to get that particular tablet because it's supposed to be very effective at killing persistent Borrelia infection. And then in terms of the herbs, usually the best, most potent and effective herbs come in the alcohol extract forms, which don't taste good. They're like in liquid form. And you start with a few drops and then you increase every day as you tolerate them. But I've tasted the herbs before. They taste really, really nasty. So it kind of depends on each person's motivation to taste something that like tastes awful. Some kids actually are fine doing that kind of thing. Other kids aren't. So oftentimes a combination of both herbs, essential oils, and antibiotics can be helpful, but it just kind of depends. I usually don't start there. Sometimes the herbs are better as like to transition to after you've finished the antibiotic course, or like as you're kind of getting towards the end of it.
Okay, and vitamins?
So I find that almost everyone is deficient in vitamin D, and that was one of the findings I found in terms of in the psychosis study that I did. One of our major publications was showing that in the patients with psychosis, so everybody across the board, healthy people in that study and those with psychosis were low in vitamin D. But for whatever reason, in the patients with psychosis, the inflammatory markers were inversely correlated with vitamin D. So what we saw is that in those with psychosis, they had low vitamin D, but they had high inflammation markers. And there was like a tight correlation, which we didn't see in the healthy people. Almost everybody's vitamin D deficient. So, and when I check for it. So I tell people that it's good to shoot for a level of like 50, which is usually what they would recommend if someone has an autoimmune condition. Some people are in like the teens, most people are in the 20s somewhere. So they're like low. And vitamin D plays a huge role in the immune system.
Mm.
Most people don't know that. Even just starting vitamin D can be super helpful in a patient. So I like vitamin D. I like fish oil, omega-3 fatty acids. There's been a lot of studies showing that it's helpful for psychiatric symptoms in general, like independent of PANS, PANDAS, Lyme. I like liposomal glutathione, which is an antioxidant. The liposomal form is important. It gets into the tissues better.
Mm-hmm.
I think it's just a really good, it helps for detoxing, especially when these patients when they're first started on antibiotics, things can sometimes get a little bit worse before they get better, because we can see what's called a Herxheimer type reaction. As bacteria is killed off, there can be a greater inflammatory response.
Mm.
So things like liposomal glutathione can help appropriately get rid of the detritus that comes from some of this like killing. So I recommend that with everybody pretty much. And then anti-inflammatories as needed often.
Mm. Okay. Wow, it's an incredible amount of information. So I had one more question.
Mhm.
So with adults and their Lyme in terms of treatment, um, is there anything that you would do differently than with the children?
In terms of their treatment for Lyme disease?
Mm-hmm.
Not really. I mean, as you know, sometimes with PANS, PANDAS, immunomodulatory treatment like IVIG is sometimes recommended for people who have severe symptoms of PANS, PANDAS, and they have not responded appropriately to antibiotics. Sometimes we use IVIG for adults also, not because they're presenting with like PANS, PANDAS type symptoms, but often because they are presenting with either severe neurological symptoms or even sometimes severe psychiatric symptoms. So it is kind of like the adult version. And we can often see that IVIG can be helpful. I found that IVIG in adults, in my clinical experience, is more helpful for neurological type symptoms like neuropathies and not as helpful for psychiatric type symptoms.
Oh, okay. That's interesting.
What else? Let's see. Recently, some of my colleagues have recommended like a brain training reprogramming called Primal Trust. So this is like, wouldn't be so much for kids, but it would be more geared towards teenagers or adults. But it's a way of, there's a lot of different exercises in the form of online videos or some live classes that help teach you to basically retrain your brain and retrain your central nervous system in the setting of chronic illness. What happens when you have chronic illness and trauma is that your body becomes in a constant fight or flight state. And so everything, like your sympathetic nervous system that is supposed to respond to, it's supposed to be on alert if there's emergencies or major things happening, is basically always on. And the other part of your nervous system, your parasympathetic nervous system, that is supposed to be there for you to rest and digest, which are hugely important functions in the human body, unfortunately is neglected because the sympathetic drive is like in overdrive when people have chronic infections. So I recently have started recommending people to go through this kind of program because it helps, basically teaches you how to do exercises that you can do to help calm your central nervous system. Like things like meditation, obviously yoga, these things can also be helpful in those domains. There's a lot of interesting like wearable devices now that are just coming on the market that purport to like also help change your central nervous system through like different ways. Like some of them use vibrations, for example, to help decrease your overall stress in your body. A lot of people are talking about vagus nerve stimulation, where you can buy vagus nerve stimulators. The vagus nerve helps basically like put you into a parasympathetic mode. So puts you into the rest, digest, calming mode. So I think there'll be like, hopefully we'll make some interesting advances in science as we better learn how to do exercises and learn exercises to manipulate our bodies a little bit so we can have better control over these things. Because it is unfortunate, because there's, you know, especially people who have Lyme disease, there unfortunately has been a lot of stigma, and oftentimes they've been sick for a long time. They've experienced a lot of invalidation from medical providers, sometimes even family and friends. So it's all of that is highly traumatic on top of being like physically very ill. And so it becomes a very long journey of recovery. And a lot of these patients, you know, we know from epidemiological studies that they're at higher risk for suicide. They're at higher risk basically for all psychiatric conditions. So this is something that we really need to be alerted towards, and we need to do everything we can to kind of reach out to this population of patients, because they're very underserved at the moment.
So it's really important to look at the whole person in their environment and not just eliminating the Lyme disease, for example.
Yes, exactly.
This concludes part 2 of episode 3. We hope you'll continue on to part 3. For more information about Pandas and Pans and the Alex Manful Fund, please visit thealexmanfulfund.org. The content in this podcast is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition.